Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Felicia Houk, the owner of Shifting Tides Chiropractic in Menasha, Wisconsin. Dr. Felicia is a neurologically based chiropractor who specializes in pregnancy, infant and pediatric care, and educating her patients about how stress impacts the way our brains process and function. Her clinic is also a certified Perfect Storm pediatric office that helps children calm their brains and better process the world around them. When she's not serving patients in the office or hosting a local lunch and learn, you can find her traveling, enjoying the outdoors, staying active, and building a life rooted in self-sustainability. Help us welcome her to the podcast.
Hey, everybody. Welcome back to the Motherhood Alliance podcast. We are back here with Dr. Felicia. We've had such great conversations in the past couple episodes here talking about immune health and what makes us sick. I don't know. And we were just talking about this a little bit off the mic too. I've just had a lot of thoughts and stuff, and I'm really looking forward to re-listening to these episodes too. And just talking a lot about how the nervous system works too in the first episode. So if you guys haven't listened to those, I think that you'll not only agree with a lot of the things, but it'll just kind of give you a fresh perspective and just kind of a different way of thinking about things. So I highly recommend taking a listen to those. In this episode, we are going to be talking about specifically pregnancy and kind of the different aspects of how women tend to think and put pressure on themselves during pregnancy, how stress can affect the baby. And Dr. Felicia is very passionate about this topic. So I think that what I want to open up with is when we think about the expectation of women today, the pressure that we feel from society, can we just kind of talk about that and where the stress is coming from?
Yeah, I mean, it's exactly that. It's what society has told us we have to do. Even when you think about the first moments when you find out you're pregnant, yes, there's excitement, but usually there's at least a little inkling of fear and this worry or unknown. And I do believe that that's designed. Yes, there's unknown, but I think it's been designed through society to say that there's supposed to be fear there. And it really isn't. It's not supposed to be. We're designed to create life, yes. Grow babies and create life. We're designed for that. But society has kind of built in this fear, these fear-based, ideas and even questions, right? So what are the purposes of our checkups with the doctor? To make sure the baby's okay. Well, then we're assuming that the baby's not okay, right? So we're making these continuous assumptions. I mean, every visit, it's true. We got to do the anatomy check to make sure baby's okay. We got to make sure we can find a heartbeat. We got to make sure and it's all in the assumption that baby is not okay, or that our body can't do it. And then there's, again, the societal expectations, the things that we say to each other are important. So wow, mom, you're doing this and you're 38 weeks, 40 weeks, you're super mom. Yeah. What gives us the, what if someone, stopped working and gave themselves the rest and the love and the care that they needed they're also a super mom or a super woman, and saying no is good. It's important. Societal expectation basically just tells us that we've got to be frizzle-frazzled, even in one of the most important, activities and parts of our lives.
Yeah, and I like how you're kind of taking it high level. Like there's the overarching feelings that we get from society and probably some from the medical system and things like that. But then there oftentimes are the inadvertent little things that our friends and family are saying. I think something I struggle with here is that when negative things do happen, people oftentimes want to spread the news for awareness. But then that also instills fear. So how do you balance that?
Yeah, that's a good question. I think that in all things, fear can overpower, right? And there's always a fear of like death or dying or problem, right? But the more that we think about that and think on the negative, the more that we actually create it and manifest it. And that's part of that stress, right? So like our brain hears what we say. Okay. And so if we're saying, oh my gosh, I hope my baby is going to be okay. I'm worried. I don't know. Guess what? Baby hears that. Our brain hears that. And it will create this sort of environment where we are afraid, right? And fear and stress can then actually tell our brain like, hey, this maybe isn't the right time to create a baby or bring life into the world, right? Because it's seeing the world as dangerous. It's seeing the world as threatening. Okay. A girlfriend of mine was talking about how she watched this really amazing video of some kind of as like a deer or an elk or something like that. And it was giving birth. And then it spots a lion. And it's like the baby's like halfway out. And it literally like puts baby back in, like sucks baby back in and runs from the lion. And it's an incredible thought, but obviously we aren't being chased by lions and bears, but our stressors literally are those lions and bears. Mm-hmm. Okay. And so it's the same concept. Like even if we were talking about infertility and the issues of conceiving, if you're stressed out, your brain's telling your reproductive organs it's not safe to have a baby. And so comes back to that stress topic again and how we combat that. But
in our first two episodes, we talked a lot about the stresses of life and how we can't always avoid stress. Yes, there's always some things we can do to try and help minimize our stress, but there's always going to be some stresses there. And instead we need to power up our brain, right, in order to combat that. So how does this apply to pregnancy? Because you are growing two lives now. And so there's the normal stresses of everyday life. If you're a working woman and you have the normal stresses of that and home life and maybe aging parents and whatever else is going on in your life. But now you also do have pregnancy and those fears that are coming in from society. So it's really compounding and building even more stress into your life. How do you combat that during pregnancy to help minimize that fight or flight response so that baby is not hearing those words and maybe you can try and culminate a calmer environment?
Yeah. I would say that there's actually a lot of things. And one of them I kind of talked about before is being able to say no. Like it is okay, but it's like wired in women that we're just like, yes, and we want to please everyone because it's part of our nurturing. But understanding that when we are nurturing a life and creating a life, that we have to say no. And we should be saying no a lot more. And it is okay to say no. And the only person that feels bad about saying no is us. And that's it.
It's true.
And that, again, I think we'll go back to like what we tell ourselves is true. So making sure that you have a firm vision and idea of, your pregnancy and that it is a blessing. It's a beautiful thing. It's incredible. And if someone is telling you maybe a negative or a narrative or even an experience that they may have had, that does not mean it is your experience, right? And so even telling yourself, like in your head, thanking them and being like, thank you for, sharing your experience. It's not mine, and just having that like firm power instead of going, oh my goodness, I'm worried because they just told me that story. Oh my goodness, because that is actually like creating and manifesting the bad narratives.
As a chiropractor, you are working hands-on people. What are some physical signs that fear is and anxiety and stress are kind of too high in a body?
Mm-hmm. I would say, so there's a commonplace thing that obviously during pregnancy, we have a lot of hormones changing, shifting, spiking, all that sort of thing. And our body should be able to, it is designed and built to be able to adapt to those things. So I would actually say that when women are having very, very big emotions, it's a sign that we're not adapting and that we have stress. So if during your pregnancy you are crying a lot, if during your pregnancy you're feeling stressed, overwhelmed, fearful, those are signs. And I know those are a little bit more of the mental sides, but really all signs or problems that could go wrong in pregnancy, they're things that are common, but they're not normal. And that could be like the carpal tunnel. That could be literal, like the nausea or morning sickness, right? So like that in and of itself isn't normal. It's common, but it's a sign your body isn't adapting to the changes that it should be making and it's designed to make. So morning sickness even. So I'm sure that perked a lot of interest. Yeah.
How do you, as a chiropractor, approach a pregnant woman differently than a non-pregnant woman, especially with your techniques that you use and being neurologically based?
Sure. So we do still look at the brain in the same way. So torque release is still the same. What we do is we add on several other components, and that is what's called the Webster's Technique. Okay. And that's looking at ligament structures and how to support that as the pelvis and the hips, the belly are changing, as well as our muscles and how to stabilize and support those areas. Because weight distribution changes and obviously things become more lax. So it's supporting those areas, creating balance in those areas, and making sure that, mama is still moving and able to move. But then there's a lot of that kind of positive aspect as well of like, let's have the, let's talk about what you're afraid of, or let's talk about your birth plans. Let's talk about these things, because if we're not talking about them and the only story that they're receiving is maybe from the medical side, they're getting the negative narrative, right? They're getting the fear-based narrative. And it's like, hey, did you know there's a completely different way we can look at this? And that's really, really important too, because a lot of women don't even think that they can give birth naturally, or that they could handle the pain, or even understanding the purpose of the pain during birth and why it's there. And, maybe the repercussions of what happens when you're given like artificial oxytocin, which is Pitocin, right? Like, what does that actually do? Because your doctors are not having those conversations. And the more that you can learn, the more informed you are, and really truly informed consent, right? Where you're seeing maybe the both sides or both views, then you can make a better decision.
I feel like you said, a lot of women don't understand that they have choices. They're kind of just put into the system. I know with my first one, I kind of was, but there were still things that I was questioning. So I ended up like looking into more of like a birth center or midwife. Ended up going with a midwife in a hospital at that time, which was fine. But it's important to be asking questions and learning more so that you can, figure out if what the path you're going on is really what you need, and if it's stressing you out, So yeah, that's really important.
How can chiropractic help improve labor outcomes? Because this is a huge point of stress for women. They just sit and ponder what the labor is going to be like, what that experience is going to be like. They live in fear oftentimes. And so there is the physical aspect. There's also the mental aspect. How can what you do help improve the positive experience of labor?
Yeah, that's a great question. So again, it comes down to that brain. We're either in fight and flight or we're in that thriving, mode. And if we're in the fight and flight and things are really scary and we've been in that mode for 9 months and then we add on something that's hard, right? An additional stressor, but is hard. We only have a capacity for so much stress. And so when the boiling pot boils over, then we can make more rash decisions or decisions that we don't truly want in our experience. So one of the amazing things about neurologically based chiropractic is that it increases that capacity to handle those stressors, right? Because maybe you do have to work until, the day your water breaks and things like that, right? So it's like, hey, we need to upgrade the brain to modern living so that we can handle our stressors. And when I say truly handle, I mean truly process them and handle them, not just store them under the rug and say we're fine, right? And just keep piling them up. But if our stressors are low or our brain is perceiving them as not there, then when we are tasked with something that is harder or more difficult, the actual birth process, we can handle it. Like we're ready because we're like, yeah, give me that big hard thing. I can do it. Whereas if we're already stomped down and you're putting another brick on top of me,
You can't handle it.
You can't handle it.
And that's when you have physical issues or, locking up kind of thing.
Yeah, physical, emotional, the like, I can't do it. Just give me the epidural. I can't do it, and it's like, no, we can, and we're designed for this, but it's understanding that entire process is super important. Not just like waiting till the end and going, oh my, now what?
Yeah. I remember when I feel like most women are going to be like, I can't do it. It's really hard. And you want to get out of it because you are kind of in that fight or flight during labor a little bit. But I think surrounding yourself with that birth team and making sure that things are going kind of the way that you had planned as best as you can is really important too. So thinking ahead and making sure that you're fully supported is important.
Yes. Yeah. And I would say that, that also comes down to making sure that your husband and yourself are on the same pages. And I would also say that while there is a need to respect your husband and their wishes, it is your body and what you want. You really need to bring them up to that. Because a lot of men, they don't want to see their wives in pain.
No, they want to fix the problem.
And they're right. They're the fixers. They're the saviors. And understanding that like, hey, this is going to be hard, but I need you to have, this role, right? Because a lot of women will succumb to their husband's fears and then they won't have the birth that they desire.
And I know that you have some unique ways to help people in the postpartum timeframe in your office. Can you share about that?
Yeah. So we have a red light therapy option, or a red light instrument, if you will. And what that does is it allows women to really, I think, be able to get their energy back and their confidence back. So we talked about light therapy before. This is a similar, it's light therapy. It's just specifically the red wavelengths of light. Light in general helps give energy to your cells. So it's really, really helpful, especially in those moments of maybe sleepless nights, to be able to have the energy to heal because your body is healing, but also have the energy to nurture and caregive. And then there's aspects of it as well that help to kind of get us back to or become who we are now, right? Because once you've had babies, it's like you're finding yourself again, right?
It's different.
Yes, and finding the confidence and strength in your body, things like that. So we have red light that can specifically target skin. A lot of women can be very self-conscious about their bellies, stretch marks, if they did have any sort of scarring and things like that, or surgical stuff with scarring. So our red light helps keep your skin healthy. It can reduce and completely eliminate stretch marks, and it can help that healing process with the scars as well. So
it's amazing.
Yeah, we love it.
You're obviously an expert in this neurologically based approach and just understanding stress, and you educate people all over Northeast Wisconsin about stress and the effects it can have on their bodies. Postpartum is a tricky time frame because not only are you recovering physically, there's the societal pressures, like we talked about in the beginning of this episode of if somebody's coming over, I have to have my house clean. Like even just little things like that, like why? But then there's also, we're learning new things. There is lack of sleep. There's new routines. You're figuring out how to feed this baby. You're learning about each other, all of these different things. If you could give a woman between, I don't know, whatever you think, 2 and 5 top things to focus on that's going to help her de-stress the best that she can, or just support her body the best that she can, or up her brain to be able to handle this time of life, what would be those like 2 to 5 things that you would recommend she's doing?
I'm always going to say keep the consistency with your chiropractor. It's really important. Just like how you have, checkups with your medical doctor and even for baby, right? Checkups. The chiropractic care is just as important because it's going to help you to heal both physically and emotionally. It's also going to help you get baby checked. So if there's issues, with baby not sleeping for long periods of time or digestive issues, again, you're getting better informed consent because you're hearing 2 sides of the story. Well, why is baby not digesting? Is it because all their organs don't work right? No. Is it because the milk that you're breastfeeding is bad? No. Let's get a different formula. No. It's not those problems. It's not those issues. So chiropractic is very, very important. It helps keep the stress down, right? And that's going to allow for healing. I would also say that like saying no is again important because it's almost like you go back into the full swing of life, but you've added like a million extra things.
Yeah.
So it's important to like say no to company and say no to, things like that. I think also it can be really difficult in our society to receive. And so when people offer things, to say yeah. Like if the mother-in-law wants to cook for you or she wants to come over and hold baby while you shower, you give yourself that opportunity and you shower, or you receive those gifts instead of trying to show the world that you're independent.
I would also add to that, ask.
Yeah.
Like don't be afraid to reach out and ask for help. I feel like pride gets a lot in the way.
And talk about it.
And just, yeah. Mm-hmm.
Yeah. Like these aren't taboo topics. These are things that people around you, they love you and they want to know about. They want to help you and support you.
Mm-hmm. Yeah. And just thinking about the village that a lot of women used to have before we got so busy in the society that we live in, of the support system. And we need to build that for ourselves. It's really important. This was a great episode as well. I love how we've been able to tie all 3 of these episodes together. They're very different topics, but they all blend. And I'm noticing a common theme of stress here, which I think everybody can relate to. So we do have one more episode coming up. Our final episode together, we are going to be focusing more so on those kiddos, which is, I know you're going to have some things in this episode that a lot of parents are really going to be interested in hearing. We're going to be talking about the trauma of birth. We're going to be talking about children's health in general. And we're also going to be talking about like ADHD and sensory processing and, why are we seeing an uptick in kiddos struggling with things like that? And so this is going to be a great one coming up. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.